I'm pleased to talk to you about the randomized phase 3 study from the Canadian Clinical Trials Group, HE1. It's a randomized study that is looking at the benefit of palliative radiotherapy to improve patients' pain from primary or metastatic liver cancer. So this trial was a one-to-one randomized study with centers from across Canada accruing for patients who had no standard treatment options, so were very close to the end of their life with a high burden of cancer, either diffuse involvement of the liver, more than 50%, more than 10 lesions, and as I mentioned, not candidates for standard therapy. Patients were on analgesia but still having a substantial pain. They had to have at least a pain score of 4 out of 10 to be eligible, and the average pain score of patients who were accrued to the study was in fact 7 out of 10 despite the use of analgesia. In this study, patients were randomized to best supportive care, analgesia, palliative care as standard of care, but those in the experimental arm received one single dose of palliative radiation to their whole liver or near whole liver with an antiemetic, including a steroid to prevent nausea. The primary endpoint was patient-reported pain at 1 month following this intervention, and then those who didn't receive radiation therapy had the opportunity to cross over and receive the radiotherapy with one other follow-up at 3 months following treatment. So this was a pragmatic, simple trial looking for a large effect size. And in this study, we did accrue patients and in fact found that we met all of our primary hypotheses and our primary endpoints and secondary endpoints. And so we used the brief pain inventory tool to measure pain, and the primary pain endpoint was patient-reported pain at worst in the past 24 hours. And at 1 month, 67% of patients who were randomized to radiotherapy reported a clinically significant and statistically significant improvement in pain compared to 22% who are on best supportive care. And when we looked at other pain questions, similarly, they were improved in patients who received radiotherapy. What we did in this study is we did a sensitivity analysis and assumed that everyone who did not complete their 1 month patient-reported outcomes had worse pain. And even with the sensitivity analysis, there was statistically significant and clinically important improvement in patient-reported pain. There was also a trend for improved quality of life in this study, and somewhat excited, the survival at 3 months was also improved in patients who received radiotherapy. So the 3-month survival was 51% with those who received radiation versus 33% who received best supportive care alone, with a p-value of 0.07. The overall sample size in this study is 66 patients. As I mentioned, we were looking for a very large effect size. So clearly the secondary endpoints, including survival, are hypothesis generating. But given that the primary endpoints were all positive, I think this is a practice-changing study. And around the world, simple low-dose radiation, 8 grade 1, can be used to help patients who are in pain near the end of their life, whether they have primary liver cancer or metastases from other cancers. And hopefully we'll do other studies of palliative radiation for liver pain now that this has shown we really can help many patients.